Hi, everyone. I'm Lisa,
And I'm Steph.
and together we are
PD
PD Connect. Thanks for joining us today.
We are PD Connect. We're a nonprofit in the San Francisco Bay Area, but virtually wherever you are. And we teach exercise and education for people with Parkinson's. And you're at our speaker series today. Thank you, Michael, for being here.
Yeah,
Take it away,
today
Lisa.
we have Michael Thompson, who is going to talk to us about Medicare and all of its benefits, and also some of the changes specifically for 2025. It is now December 2024, so we are going to talk about some of the changes coming in 2025. He is from the Senior Advocacy Services in the northern, where are we? In the North Bay of Northern California. But we're just so glad to have you, and thank you so much for sharing your expertise with us. So I'm going to spotlight you.
And you'll have to unmute.
Can you hear me? Good to go. All right. One moment here. Let me get rid of all these notifications that are popping up. Thank you so much for having me. It's a real honor. My name is Michael. I'm with HICAP. HICAP stands for Health Insurance Counseling and Advocacy Program. We really like to stress advocacy because we are here for you. We work with Medicare beneficiaries at all levels. We help in a number of different ways. We work one-on-one with you individually through our counselors. We have 32 counselors that work with you. You can set up individual counseling meetings either over the phone, or we do have designated meeting sites in which you can set an appointment to meet with a counselor. So we'll talk a little bit about that today, and as we mentioned, we're going to talk about we're going to talk about a lot of the foundation of Medicare, just to get everybody refreshed on the foundation of Medicare. But we'll also be focusing on a lot of the changes that are coming up in 2025. We'll also be talking a little bit about annual open enrollment period, because we do have a few days left of the annual open enrollment period. So we're going to be talking a little bit about that too. So let me see if I can share my screen and we'll just get right into it. Bear with me, I'm trying to move this little toolbar that won't go away. There we go. All right. Can everybody see the HICAP logo? Perfect. All right. So HICAP, again, Medicare Health Insurance Counseling and Advocacy Program. We are the technical experts on Medicare. Again, we provide educational seminars, individual counseling, but really one thing that we want to stress is that we're unbiased. So many folks feel like they have to turn to an insurance agent when in fact you do not have to. We can assist with enrolling. We do not enroll for individuals, but we can help with the enrollment process and point you in that direction. Again, it's very important, the unbiased portion of our services. That way you are secure in knowing that we're not here trying to sell you something. If you look on the back of your Medicare and You book, everybody should have gotten a new one starting in October. They started sending those out. If you look at the back of the Medicare and You book, it actually has HICAP's phone number on there for you. So we are directly related with Medicare. Our funds come from the Older Republicans Act. We are the only agency authorized by the California Department of Aging to offer Medicare seminars. And your particular HICAP here in Petaluma serves 6 different counties. We serve Lake County, Mendocino County, Sonoma, Marin, Napa, and Solano. So those are all the areas that our HICAP services. If you have friends or family in other counties, there will be a HICAP available to them. You can always point them in that direction. You can always just Google HICAP and whatever your county is, and you'll get the direct number there from them. So that's a little bit about who we are. Again, we are publicly funded through the Older Americans Act. So we do have state and federal funds, which is what allows us to do what we do and not charge. Um, if you're outside of California, you probably will not be recognizing the name HICAP. The program is nationally known as the SHIP program, State Health Insurance Program. So again, outside of California, it's more well known as SHIP. We have 4 staff members, but we have 32 Medicare registered volunteer counselors. So as you can imagine, working with 6 counties, so far we've worked with 3,300 people this year. We could not do that without our volunteer counselors. Our 4 staff members could not help the amount of people that we are helping without those really cherished volunteer counselors. Again, free and unbiased phone and on-site counseling. We really specialize in the coordination of care, managing multi-layer coverage, helping individuals understand how Medi-Cal works in conjunction with your Medicare. We help those understand how it works with not only just the Medi-Cal, but also in coordination of care with their employee group health plans as well. So those are some of the some of the ways that we assist people daily. We have educational workshops, much like the one that you're seeing today. Although this is a very shortened version, we try to shorten it up when we're on Zoom. If you ever want to come see one of our full-length versions, feel free to go to our website. We will give you that information later. But we do offer a 4-part series, all talking about Medicare, surprisingly, but we try and do it in different ways, focusing on different aspects of Medicare through each one of those series. So again, you can always take a look at our website. More than likely, we will have one of those 4-part series in your area. Feel free to stop by and come check it out. So what is Medicare? Let's do a refresher. Medicare, federal health insurance program, passed back in 1965, so we're celebrating 59 years. We're really hoping it's around for at least another 59 years. To be eligible, you have to be a U.S. citizen for at least 5 years. You've got to be 65 years or older, unless you've been on Social Security disability for over 2 years. If you have been on Social Security disability for over 2 years, then you do qualify for Medicare. So I work with folks of all ages that are getting Medicare. If you have in-state renal disease, you're qualified for Medicare. If you have Lou Gehrig's disease, you're qualified for Medicare. But special note, Medicare only provides coverages on U.S. soil. So if you are traveling, if you're taking that trip abroad this year, we highly recommend that you get travel insurance. So again, in refreshing with Medicare, we talked about Medicare being around since 1965. When it first came on board and was introduced, we had Part A and Part B only. Part A is your hospital insurance anytime that you're admitted into the hospital. Part B is your outpatient. I like to call that your everyday needs. Anytime that you go to your primary care physician, anytime you get medical equipment, etc., that's when your Part B starts kicking in for you. But it's very important to understand that although this is the foundation of Medicare, these 2 parts really do not make a complete package. You really need to purchase other pieces to make it a complete package in the aspect of covering you financially. So let's review why. So again, the foundation of A and B, the issue and the problem with it is that it only covers 80% of your medical costs. So when this program first came on board in 1965, it was great. All of a sudden, you're getting 80% of your hospital stays covered. All of a sudden, you're getting your daily needs covered. but only at 80%. So that is why they have introduced other parts to Medicare over the years, which we'll get into later. But for now, let's stick with Part A. What is Part A? Again, it's your inpatient. Anytime you are actually admitted, and that's an important little detail there. You actually have to be admitted. A lot of times you are under observation. So if that ever happens to you and you are placed into the hospital, make sure you ask, am I here under observation or am I being admitted? Because as soon as you are officially admitted is when your Part A starts working for you. Now, most of us do not pay a premium for our Part A. Our our premiums are $0 as long as we have paid roughly 10 years into the Medicare program through our employment. It's 40 quarters. Again, that equals about 10 years. And as long as you have paid into the Medicare over those 10 years, you have a $0 premium. For some folks who have not paid into the Medicare program, they could be subject up to $278 all the way up to $505 for their monthly premium. There is a very expensive deductible that goes along with your Part A, which is another reason why if you just had Part A and Part B, we highly recommend looking into additional aspects that we'll talk about here in a minute. But the deductible of $1,684, which that's going up, by the way, from $1,632 in 2024. So we'll see that increase happen January 1st. And that deductible is not annual, it's per benefit period. Let me explain what that benefit period means. If you go into the hospital and you're admitted into the hospital and they release you from the hospital, and you do not have to be readmitted into a hospital for a 60-day period, that benefit period closes out. If you have to be readmitted into the hospital again within that calendar year, guess what happens? You get another $1,684 deductible. So this is a perfect example of why we highly recommend getting supplemental insurance. There are copays, and what does Part A do? It helps you with your hospital stays up to 61 days. It helps you with your skilled nursing. It helps you with hospice, and it also helps you with transfusions. On the other side, we've got that other piece of our foundation there, the Part B, your medical outpatient. Now, with this one, everybody has a premium. The minimum of that premium, what most of us in America pay, is $185 starting January 1st, and that's going up from $174.70 currently in 2024. So we'll see a slight increase in that by about $10. We'll also see a slight increase in the deductible, which currently is $240. It's going to be going up to $257. Now, this is a much more digestible deductible in the fact that it is annual. It does not have that benefit period situation that we have with the Part A deductible. So $257 starting January 1st will be annual. And again, what does Part B do? It helps you with your doctor visits. It helps you with your clinical visits, ambulance visits, and your medical equipment. So that is all your Part A. And again, the issue is it only covers 80%. So over the years, Medicare has added pieces to our Medicare to help us with that extra 20% that Medicare does not cover. And they have added pieces like the Part D prescription drug coverage. So if you look on this screen here, we have a red line drawn down the middle. And we've done that on purpose. We want to create a visual to help you understand that there are now two very separate and different ways in which you can choose to have your Medicare. On the left-hand side, we call it Original Medicare. So again, back in 1965, we had our Part A's, we had our Part B's. Over the years, they said, how else can we improve Medicare? Well, they added that Part D prescription coverage. All of a sudden, we now have help paying with our prescriptions. That wasn't enough. because the 20% that was left on the table that we were having to pay out of pocket was still enough to bankrupt many older Americans. So Medicare came out with what's called a Medigap product. It's an insurance plan that you do have to purchase. You do have to pay for it on top of your Part A and your Part B coverage. But this closes that gap and pays for many of those deductibles, current co-insurance, and copays that you're left with just Part A and Part B. With original Medicare, when you have all four parts, it's a complete package. You're really just left with your monthly premiums. You really aren't coming out of pocket for much more than your monthly premiums. The benefit to original Medicare is that you have the right and the ability to go see any doctor you'd like in the United States as long as they take Medicare. On the other side, we now have Medicare Advantage plans. So in the 70s, we all saw a rise in plans like Kaiser, HMOs, PPOs, those types of plans. They became very popular in America. Medicare said, well, let's incorporate that. Let's start allowing Advantage plans to become part of Medicare. And so they did. And when you combine all of them, as you can see here, it all becomes one piece. You no longer have to purchase these four individual pieces. Your Advantage plan simply becomes one. Again, the big difference is with the Advantage plan, you are going to be stuck to the network of doctors within your HMO or PPO versus original Medicare being the big difference that you can go any doctor you want. There is no network of doctors as long as they take Medicare. So original Medicare, that Medigap plan that we were talking, again, it covers your deductibles, coinsurance, and copays. That is not part of the open enrollment that's happening right now. The open enrollment is for Advantage plans and also for your drug plans. But it's important to understand how the Medigap plan works. It's important to understand that it's still an option that you can go back to, even if you are on an Advantage plan right now. So if you happen to be on an Advantage plan, if you happen to be in open enrollment on your Advantage plan, Medigap is still an option for you. So we'll talk about that. If you are on a Medigap plan currently, this is not your annual enrollment period. Your annual enrollment period happens to coincide with your birthday plus 60 days, just so we're clear about that. So 60 days plus your birthday is your open enrollment period for original Medicare supplement plans. Now, remember I said they created these plans, these supplement plans. You do have to pay for them. Medicare standardized 10 different plans. And I'm going to skip ahead just a minute here. Let's see if I have it on here. I don't have the visual just because this is a shorter one. On my longer presentations, I give you a visual of what each one of those plans looks like. You can always go to medicare.gov. You can go to our website. We will describe each one of these individually, give you more detailed information about it. But for now, just understand that there's 10 standardized plans offered through Medicare. You can choose either one of them. Cadillac plans would be your F, G, and C plans. They offer more benefits than your lower end plans, which would be your M, N, L, and K, for example. Now, there's 10 standardized plans, but there's 29 insurance companies allowed to sell each one of these plans. So it can be very tricky on how to pick one of these plans. And I'm going to show you an easy button or a trick on how to do that through our website in just a minute. And this is what our website looks like. So if you go to senioradvocacyservices.org/HICAP, you'll come to this page. We've got tons of great resources for you here. One of them being with the Medigap plan rate search. So if you are considering going back to a Medigap plan, switching from your Advantage plan, going back to a Medigap plan, or if you're currently on a Medigap plan and you'd like to see if there's another insurance company that can beat the price of your current insurance company selling either the same plan or a different Medigap plan, highly encourage you to come to our website, click the Medigap plan rate search button, tell us which plan you're looking at, and we make it real simple. We go through the complete database, we narrow it down from 29 companies to the 3 least expensive insurance companies that sell the plan that you're interested in. So we can save you tons and tons of time there. So again, utilize that Medigap plan rate search. Prescription plans. Again, this is talking about if you're on original Medicare. If you're on original Medicare with a supplement plan, you'll need to get an independent drug plan. And right now, there's 23 plans available in 2024. We're going to see a drop in that. We're going to see that decrease to 16 plans come 2025. So 16 plans, but the premiums all differ. They range between $1.80 to $183.50. And these change every year. For example, right now in 2024, the least expensive premium plan is 46. So we're seeing the least expensive increase by quite a bit. And then again, maxing out at 183.50. Now, each one of these plans has different deductibles ranging from $0 to $590. The formularies change every year. So one thing that we get every January is we get a increased volume of calls. People saying, I'm at the counter right now. I'm trying to get my prescriptions that I need. And I'm just now finding out that the prescriptions that were covered on my plan last year are no longer covered. So we highly encourage everybody to take a look at their current plan. And if you do nothing else with your Medicare, we at least encourage you to make sure that your prescriptions that you're taking now are going to be included in your current plan come January 1st. And if not, you can go back to our website. You can use let's go back, Part D search worksheet there. And it does the same thing that the Medigap plan rate search does for you. It will find it'll give you the 3 least expensive drug plans that meet all of your needs and include all of the prescriptions that you're taking. So again, highly recommend that you take a look at these plans. There we go. We've got that Part D search worksheet there for you. So there are some changes happening with the Part D plans for 2025. Some we're very excited about. Number one being the Part D out-of-pocket costs are being capped this year. On average, in 2024, the out-of-pocket costs were around $3,500, going up to $5,000. And now it's going to be capped at $2,000. So we're applauding that one. We're really excited about that. The downside, and we're hoping that it's temporary, the downside to that, maybe the domino effect, is because they have capped the out-of-pocket cost at $2,000, we are seeing the premiums increase. So some of you may have got notices in the mail saying that your premiums are increasing. And this is one of the reasons, although we do hope that as time goes on, we will start seeing our premiums decrease as the market levels out. We are also seeing a change with the donut hole. If anybody knows what the donut hole is, we're extremely happy to announce that this has been eliminated come January 1st. So anybody not familiar with the donut hole, it was simply a situation where people would come out of meet their out-of-pocket costs, and they were still having to pay 25% of their drug costs. until they got to the catastrophic level of $8,000. So there was a gap in coverage for many people. We're very happy to see this donut hole go away. We will not be having to talk about this come January 1st anymore. The third and final big improvement with the Part D for 2025 is that they've introduced what's known now as a Medicare prescription drug payment plan. We're excited about this. There's a lot of nuances, and so let's talk a little bit about that. One, the prescription drug payment plan, it's completely voluntary. It may not benefit you if you're not expecting to spend the $2,000 max cap. But for the folks that are expecting to spend that $2,000 in a calendar year, this could certainly help them. So again, it's it's voluntary, but what it does basically is it allows you to spread out that $2,000 max out of pocket over a 12-month period. The other way that we're seeing that it's going to help folks is many times people need a prescription right then and there. They need to go to the counter, they need that prescription, but unfortunately, they can't afford it. Maybe it's in the middle of the month, finances are tough. With this program, what that's going to allow folks to do is to be able to go pick up their much needed prescriptions at any time, and they can simply be billed for that and they can pay for that at the end of the month. So we're seeing this as a big positive, and we're excited about this plan. And there is a special note. If you do fail to pay those monthly installments, you will be kicked off or dropped from that plan, but they will not disenroll you from the plan. You will be responsible for paying that balance before you can pick up any further prescriptions, but take comfort in knowing that they will not drop you off of your drug plan for failure to pay the monthly installment. Okay, so we've talked about original Medicare. We've talked about the four pieces that you need to purchase to make original Medicare complete. So now let's talk a little bit about the Advantage plans. The Advantage plans, 9 times out of 10, you're going to see lower monthly premiums with an Advantage plan. I think that's the number one reason why we see so many people choosing the Advantage plans these days. Right now, you can actually find some plans with a $0 premium. So again, that's probably the number one advantage to the Advantage plan. It's a managed care model. So if you're familiar with Kaiser, you'll understand that. You know what an HMO or a PPO is. HMO is going to be a real tight network of doctors that you'll be restricted to seeing, whereas a PPO will typically be a larger network of doctors, and you can usually pay extra to see doctors outside of that network. But either way you choose, PPO or HMO, they are both known as a managed care model. Another advantage with the Advantage plan is the Part D prescription drug plan is typically included in this. It's all encompassed into one. Also, many of the Advantage plans will throw in additional benefits that original Medicare typically doesn't cover, meaning dental and vision. So some of the plans out there, I know Kaiser's enhanced plan this year allows you to pay a little bit extra, and they will provide you with a vision and I believe even a dental plan. I'm not super familiar with all of the plans out there, but I do know that many of them will throw some of these benefits in there for you. There is a pre-approval process. So this could be a big disadvantage to the Advantage plan. We like to educate people on. And in my full length presentations or classes, we get pretty detailed on this. But for today, we'll just kind of skim through it. Basically, the pre-approval process, if you need to go outside of your network for any reason, maybe it's a rare cancer, maybe it's a specialized procedure, and your network of doctors does not have anybody who is highly skilled in that. Sometimes you may try and get pre-approval to go outside of the network of doctors. For example, many people here in the Bay Area like to go to Stanford, especially for cancer. If you were on an Advantage plan and you wanted to go see, if you wanted to go see Stanford, you would have to get that pre-approved through the insurance company before you could do it. And unfortunately, uh, a high percentage of that is the answer is no. So that could be a big disadvantage, is having to be part of that pre-approval process. If you were on original Medicare with a supplement plan, you wouldn't have to have that approval. You could just schedule that procedure at any doctor that has or takes Medicare. Another disadvantage is the pre-authorization policy that many Advantage plans have. Pre-authorization means if you want to have a surgery, for example, maybe a knee surgery is recommended by your primary care physician, you would have to have that surgery pre-authorized through the insurance company before you could schedule that. So that would be another disadvantage to the Advantage plan. And again, we've already talked about the network of doctors. And again, the geographical coverage with your Advantage plan typically is limited to your county. So even if you're on Kaiser, for example, we all know there's Kaisers pretty much everywhere in California. But if you look on your Kaiser card, it will tell you that you're part of a network, maybe the North Bay, maybe the South Bay. But either way, it's part of a geographical limitation with your Advantage plan. There's a couple changes happening with Advantage plans for 2025. The biggest is that we're seeing a decrease in plans. So right now, just in the 6 counties that we work with in Northern California, there's about 110 plans available, and we're going to see a decrease to 90 plans come January 1st. So that's the biggest change that we're seeing with the Advantage plans. Also, we are in January, we are going to see that every single county where we serve is now going to have a $0 monthly premium plan. So everybody will have an option to get on an Advantage plan and pay $0 monthly premium. And I said earlier that the number of Advantage plans depends on the county that you live on. And this is an example here. So in Sonoma County, we have 16 plans available to us. In Lake County, there are 3 plans. In Mendocino County, there are 6 plans. So we're pretty fortunate to have a decent number if you happen to be in Sonoma County. If you're outside of Sonoma County, Marin County, you can go to our website and you can take a look at the number of Advantage plans, including all of the details for each one of those plans through our website. You can also take a look at them at Medicare.gov as well. And we're back to our website here. One of my favorite features of our website is the orange button there. That is your easy button. That gets you in contact with one of our Medicare specialists that will sit down with you, work with you one-on-one individually, help answer any questions you may have. When you click that button, you'll be given the option of choosing whether or not you want a phone consultation, or if you'd like, again, there are certain locations within each county designated where you can go and meet with a counselor one-on-one. So whichever avenue is easier for you, we can accommodate it for you. If you're not good at the internet, it's okay. Just give us a call. We can help set these plans up and set these appointments up over the phone for you. But again, if you are good at the website, take a look at this. The resources that we have are fantastic. We also have that Medicare resource link up at the top there too. So feel free to take a look at that. We have so much information on there. We have direct links to other resources. And then finally, the very right-hand button, the educational learning series, you can click on that. that's where you can see where my classes are coming up. And you can come out and take a look and see one of our full-length educational series. And I can provide this to you. I can get this to you via email, and maybe you guys can distribute it. But these are important numbers, especially during annual enrollment period right now. We've got our HICAP number. We've got Medicare's number. So if you're trying to enroll right now, we're getting down to the wire. We've got till December 7th to make changes in our Advantage plans. We've got till December 7th to make changes in our Part D prescription drug plans. If you're trying to enroll, call Medicare right now at the 800 number. If you can't reach anybody right now, they're like Taco Bell. They're open 24/7 right now. So give them a call late at night. Have a cappuccino, stay up, give them a call. That's going to be your best option right now. And then finally, if you think you qualify for any financial programs, and unfortunately we don't have a lot of time to talk about those, but there are some financial programs out there that can help you with your Part D prescription payments. There's some plans out there that can help you with your Part B, as in boy, premiums as well. And you can always apply at those through the Social Security office too. You can also go down and stand in line. I know a lot of people prefer to do that face to face, so you can do either one, whichever is better for you. And then, of course, you can always call us and go online and set that appointment up with one of our counselors. And with that, I'm going to turn it back over to you, ladies.
All right. Let's just add a spotlight.
Awesome. Who has questions? I'm sure there's tons of questions out there. You can either unmute yourselves or you can put them in the chat. Don't all jump at once.
Bob
I
has
got.
raised.
I have a question. I was under the impression that you could not go back to original Medicare once you were on an Advantage plan, but it sounds to me like you're saying you can.
You can. That's a really good question. It's something that I go into big detail on in our in-person classes. But
And it doesn't matter any prior condition that you had, or whether
well,
it's.
that's the caveat. That's the caveat. So technically, you can apply, and you can go back to a Medigap plan if you're on an Advantage plan. Um, However, you're not guaranteed issue, meaning you can always go and apply for example, my father has stage 1 diabetes, and he went from an Advantage plan back to a Medigap plan. He did not qualify for what's called guaranteed issue, and I'll explain that in just a second. But he still found an insurance company that would sell him a Medigap plan. He had to call around. There's 29, so he had to call around, but he was able to find an insurance company that would sell him a Medigap plan, and they didn't gouge him either. Now, what you're referring to is called guaranteed issue. It's when you can go back to a Medigap plan and they can't subject you to medical underwriting. So there are certain circumstances where you can go back from an Advantage plan to a Medigap plan, and they cannot subject you to medical underwriting. It's really important because if you're pretty healthy, like even my dad, he was, borderline diabetes or stage 1 diabetes. He was able to find somebody to help him. But there's many people out there who their health conditions are much riskier. And so those insurance companies, once they subject you to medical underwriting, they find out about your health. If it's not perfect, if they find it to be risky, they do have the right to completely deny selling you that Medigap plan, or they could sell it to you but raise the price. Guaranteed issue would eliminate that. It's a situation where somebody with an Advantage plan can go back to that Medigap plan and they can't subject you to medical underwriting. But there's only certain circumstances where you could qualify for guaranteed issue if you're moving from an Advantage plan to a Medigap plan. Let me ask you a question. Without getting, do you think this is for yourself? Are you looking to go back to a Medigap plan?
It is for myself, but I have two conditions, one being obviously Parkinson's,
Yeah.
and I got a little bit of cancer in the background too. So,
Okay.
um,
So we would be looking for a way to get you back to it with guaranteed issue without spending too much time on it because it's pretty detailed with guaranteed issue. Feel free to give us a call. We can work with you on that. We can give you more details on it. But basically speaking, there are three main situations where you can get guaranteed issue if you're on an Advantage plan right now. One is if your Advantage plan went away. So earlier I said there's 110 Advantage plans right now, and it's going to 90. In a lot of our area, United Healthcare is
yeah,
no longer going to be offered. Their PPO plan is,
PO's gone. Yeah.
and so those folks that are on that PPO plan that is not going to be offered next year, they get guaranteed issue
Oh,
because
wow.
because it went away. They get what's known as a special election period. They can go back to a Medigap plan and they cannot be subjected to medical underwriting. Another situation that would allow you to do the same thing is if your Advantage plan raised their rates over 15%. So, and it doesn't have to just be their premium. It could be a combination of everything. So if that's you, and if you're looking to go back, highly recommend setting up appointment with one of our counselors because we can look at your situation individually and we can maybe help you find a way that you could go back to original Medicare. I did that this time last year with somebody with annual open enrollment period. This person found a loophole. There's another one. If you move out of your service area, you can get guaranteed issue. So I was working with somebody last year who was willing to move. They were going to move out of the county so that they could get guaranteed issue. What I did was I sat and I looked down and we found that their plan was changing and that it was increasing over 15% altogether. So we were able to get him guaranteed issue without him having to move. So I highly recommend calling and sitting down with one of our counselors. We can take a look at that for you.
Thanks. That's great information. Thank you.
I had a quick question for you. I turned 65 in June, so I'll be enrolling in Medicare. I'm not I'm not racing the December 7th open enrollment deadline, am I?
No, you'll be eligible. So you're in what's known as your initial enrollment period. So your initial enrollment period begins 3 months before your birthday month. It's you have your entire birthday month, and then you have an additional 3 months after. So it's a total combination of 7 months in which you can enroll. It's really important that you make sure that you do it within that time frame because if you are late, they can subject you to a late enrollment penalty for both your Part B as in boy and D as in dog plans. So we want to make sure that you select one of your plans within that time frame.
That's great, thank you. And I guess a question that others might have, I'm still trying to figure out how Medicare works, is of those 11 plans and 29 insurers or whatever for the Medigap, is there one that fits better with people who have been diagnosed with Parkinson's?
There might be there. I would have to take a look, and that's another thing that one of our counselors we could sit down, spend some time. We might find what's known as a special needs plan that would be best for that. Off the top of my head, I'm not familiar, but one of our counselors could sit down. What county do you live in?
Sonoma, but likely moving to Mendocino.
What's that?
I live currently in Sonoma, but I'm likely going to be moving in a few months into Mendocino.
Into Mendocino, okay. So yeah, if you're going to Mendocino, I would recommend a lot of the folks that I help out in Mendocino, they're on a original Medicare with a supplement plan because it's easier out there to just go see any doctor you want, to have the freedom to be able to go to any doctor you want. Is a big bonus when you're out in Mendocino County, just because of the limitations on the Advantage plans that are available, limitations on doctors that are out there. And you really get, you have a lot more options available. So if you want to come into Santa Rosa to see somebody, you can.
Okay,
So
that's
yeah,
better. Right.
yeah,
Not confined to the county under original.
right, yeah. So yeah, again, sit down with one of our counselors and we can help you decide on which one of those options would be best for you.
That's great. Thank you very much.
Sure.
I have a question. Being a physical therapist, do you know anything about, or can you talk about some of the therapy changes and limitations, especially because, you know, people with Parkinson's sometimes need longer term therapy needs. Are you aware of any limitations and what the upcoming changes might be?
I'm not aware of any specific changes that are going to be affecting that in 2025. Again, if there was a special needs uh, designed around Parkinson's, and unfortunately, I'm just not sure if there is one. Again, if it's an Advantage plan, it all changes between the counties that you're in. But that again, that is something that one of our counselors, when we had more time, could sit down, take a look, see if there's a special needs plan. And if there is those special needs plans, that would be something, you know, that they would work around, and that would be a difference between that special needs plan and a standard plan.
Great, thank you. Are there any other
I think
questions? Or there's one question in the chat.
is there one? Okay.
I was actually talking and I didn't realize I hadn't unmuted. I have a question if I may, and I'll try it unmuted this time. I have original Medicare, and the premium, I think you call it premium or Cadillac version of Plan F, United Healthcare. My
Okay.
understanding is, and it goes back, I go back 11 years, whatever it is with it, that it doesn't make sense for me to even look at the potential changes because I have as good as I can get at the moment under the current
You
status
do.
of Medicare.
You have the best plan out there, Jim.
So I got all kinds of medical stuff going on. My feeling is don't touch it because it's taken care of me so far for a long time.
Well, yes and no, Jim. Yes and no. So yeah, you are on you're on the top tier plan that you said F plan, correct?
Yeah.
Yeah, so you're on the top tier plan, but what you could do to just make sure that you're paying the right amount, or the least amount, right? Remember, there's 29 companies selling an F plan. So unless you're married to your insurance company, you absolutely love them and you're willing to pay whatever they want at any price. What you could do is you could go to our website or Medicare.gov's website and hit that Medigap plan rate search that I was showing you. And what we would do is we would search the database with all those 29 companies
Okay.
and maybe find you an insurance company that sells that F plan for less than what you're currently paying.
Thank you.
I have
Yes.
a question about that because I know that a lot of people on this call go to UCSF or Stanford. And I
Okay.
know for UCSF, they, you know, obviously they take Medicare, but they also take only a certain number of insurances, or let's say United Healthcare or Cigna or Aetna or whatever. Some of the services may need to be pre-approved, et cetera, et cetera. So I understand that, you know, your search would help find the better price, but then within that, do you then have to go to the facility that you're most likely to use to make sure that they operate or they take that particular secondary plan?
Well, I think what you're referring to is the Advantage plans. Remember earlier I was talking about the pre-approval and pre-authorization? That applies to Advantage plans. So yeah, they may not, a particular company or a particular network of doctors may not take certain Advantage plans. But most doctors, the only exception would be Kaiser. You could not be on a Medigap plan and see a Kaiser doctor because it's a closed network. However, for like Stanford and a lot of the other facilities out there, as long as they take Medicare, they you can go see them if you're on original Medicare.
Okay. We do have a question in the chat. Can you read that?
Yeah, I live in Connecticut and heard that the Advantage plans are not that good. What do you think?
Yeah, in Connecticut, I mean, so again, everything is completely different within counties. And now you're talking about a completely different state. So, things are just so different out there. I wouldn't even be able to speak on it, but there is going to be a HICAP in your area. So I would highly recommend connecting with your local HICAP. Again, out there, it's probably going to be known as SHIP, State Health Insurance Program. But what they can do is they can compare what is offered with your local Advantage plans uh, compared against an original Medicare Medigap plan. Now, typically speaking, the Medigap plan it covers more it covers more benefits, but again, it is going to be typically more expensive per month. But if you can do it, and also I do want to swing back around to the gentleman who's new to Medicare. Don't have time to really get into it today, but please come see one of our educational classes. We're going to be updating our website in the next 2 weeks, so you'll see a bunch of new classes that you can join and come see. But what we'll talk about is the Medigap plans and what's known as a ladder system. Don't have time to discuss it today, but the Medigap plans have what's called a ladder system. So when you're new to Medicare, you have guaranteed issue automatically. You can get a Medigap plan. They cannot subject you to medical underwriting. But if you choose a middle of the road plan, like maybe an in plan, later on, if you wanted to go up to a higher end plan, you could not do that with guaranteed issue. You can move down the ladder in coverage, but you cannot move up the ladder in coverage when it comes to guaranteed issue. So too much detail to talk about today, but come see one of our classes. We'll talk about it more in detail.
Thank you so much. This was really helpful. Hopefully it helped most people answer some questions. I just accidentally muted you, Michael, I think. Sorry.
That's okay.
Sorry about that. But thank you so much for spending your time with us. And
Yeah.
it sounds like there's going to be a lot of people that are contacting you.
Well,
Yeah, yes, please.
we just really appreciate the way that you it's confusing.
Yep. We
It's
were just
just
saying,
really
wow,
confusing,
so
and
confusing.
we're so thankful that there are services like yourself to be able to, call upon.
Yeah,
And
absolutely.
I just like the way he talks. Like, Michael, you're really nice and calm and
Yes, very helpful.
very helpful.
Yes.
Articulate.
I have to be honest, I do not like Zoom.
That's okay.
I am a really big I thrive off the energy. And there's no energy on the screen.
Yeah,
So
Yeah.
that's so
come see
true.
one of our classes.
There's one more question in the chat. Is there still
Yes.
time to answer it?
I've got time.
Somebody's got one in chat.
Let me see if I can read
Yeah,
it.
we read that. And yes, this is recorded, and like all of our other YouTube,
We'll be on YouTube.
it'll be on YouTube.
Yes.
Medicare Advantage makes its greatest profit by refusing to pay for care. Somebody wrote in chat.
So that is, well, boy, we could really dive into that one, couldn't we? But yes, in January and February of 2024, there were a lot of newspaper articles. There was a lot of press discussing that exact topic right there. There were lots of complaints about the Advantage plan refusing to pay for care, and what they were referencing there was what I was referring to earlier as pre-authorization. So when you're on an Advantage plan, you have basically a gatekeeper that can approve or disapprove whatever type of procedure or request you have. Again, remember, you have to have pre-authorization for certain procedures when you're on an Advantage plan. And the negative press that we were seeing in January and February of 2024 was that oftentimes the rate of disapproval was skyrocketed. Too many disapprovals, not enough approval for lots of procedures. When you're looking at Advantage plans, really do your research, take a look at their customer satisfaction ratings, really look at how they respond to the approval process.
Thank you. Sorry if I was a little aggressive with the question, but somebody asked that in chat, and I thought it was a good one to ask you to take a look at.
Absolutely. Happy to do so.
All right.
Excellent. Thank you
Well,
again for your
yes,
time.
Michael,
And
really
we will
appreciate you.
put this on our YouTube so everyone can see it and call you guys and ask you all the questions
For 2025.
for 2025.
Yeah, absolutely. Come see me at my classes too. I would love to see your faces in person.
Sounds great. Don't forget
And
to
then-
follow us. We're PD Connect. You can check us out at www.pd-connect.org. Don't forget the dash. It's got a lot of orange and blue. You'll see our faces. You can't miss us. Join us for exercise Monday through Friday, and soon one additional day.
Well,
But anyway, check
knows?
us out. It'll be fun. Or join us anytime. All right. We'll talk to
Take
you later.
care.
Thank you. Bye.
Thank you, Michael.